Good morning. Today our revision topic is pharmacology in dentistry. In this topic we will be discussing few drugs which we are prescribing like in routine practice by a dentist. We will discuss some questions regarding this topic with multiple choice options. The first question is non-steroidal anti-inflammatory drugs, that is we abbreviate as NSAIDs. They act by how? What is the mechanism of action of NSAIDs? First option is they act by decreasing the synthesis of prostaglandins, or they act by the synthesis of decreasing the synthesis of cyclooxygenase enzyme, or both A and B, or none of the above. So what is the mechanism of action of NSAIDs in reducing the pain? The answer is both A and B. That is, they act by decreasing the synthesis of prostaglandins and also they decrease the synthesis of cyclooxygenase. So that they will reduce the pain. Next drug is sivimelaine. It is the drugs used to treat. Where this drug is used? Is it used in the like fungal infections like candidal infections or bacterial infections, or in case of siluria, that is nothing but the increased salivary secretion, or it is used in case of hypofunction of the salivary glands, that is xerostomia patients. So what is the answer? The sivimelaine is the drug used to treat hypofunction of the salivary glands, that is in patients suffering with xerostomia dry mouth. And if it is found that the xerostomia is mainly due to the like a hypofunction of the salivary glands, in those cases we are prescribing this drug. Otherwise, if the xerostomia is due to any like obstruction in the ducts, we have to find out. In those cases, sivimelaine is not the drug of choice. Only if the affected glands are there, that is the secretion is decreased, that if that is the reason for the dry mouth, then only we are giving this drug. Next, for a dental practitioner, what are the different modes of drug delivery? That is, as a dental practitioner, what are the different drug forms we are prescribing to the patient? Is it oral, systemic, topically given, or all the above? The answer is like all these modes of drug delivery we are prescribing. That is, as tablets, as injections like IM or IV we are giving, and also topically like paste or gel forms are also we are using to deliver the drug to the patient. So the answer is all the above. Next question is gastrointestinal irritation as a side effect of NSAIDs is due to. Why? When the patient is given with NSAIDs for a few more days, patient will complain of gastric pain, that is irritation will be caused. What is the main reason for this? First option is reduced production of prostaglandins, or is it due to the inhibition of the COX-1, that is cyclooxygenase 1 isoform, or cyclooxygenase 2 isoform is inhibited, or what is the reason? Is it direct irritation of the gastrointestinal mucosa by the drug? So what is the reason for this irritation as a side effect is? The answer is it is mainly due to the inhibition of cyclooxygenase 1 isoform. So the pain reduction is mainly caused by the pain is reduced with the decreasing the production of prostaglandins and also the COX-2 isoform inhibition. But in these some drugs which are like given, even they inhibit the COX-1 also. In those cases, with those drugs we will see the gastrointestinal irritation to the patient. So some drugs are developed NSAIDs. There are some NSAIDs which will be selective on the COX-2 also. So better we prescribe those drugs if the patient is having this gastrointestinal irritation. Next is the adjuvant analgesics refers to. Actually, analgesics refers to some NSAIDs and opiate analgesics. Okay, adjuvant analgesics refers to what? Opiate analgesics are antidepressants and anxiolytics, or combination of NSAIDs and opiates is referred to as adjuvant analgesics, or none of the above. So which one is referred to as the adjuvant analgesics? That is, they are given in the patients with pain but they are not NSAIDs. The answer is antidepressants and anxiolytics are the drugs. Even the muscle relaxants are used as the adjuvant analgesics. Because they are treated, they are given to the patients to treat any chronic pains. For example, in orofacial pain patients. Which of the following is not available in tablet form? Okay, we have seen that we will be giving to the patient orally or like as an injection, or also in the like a topical drug delivery system we are giving. In that we should know which drug is available in which form. So among these drugs, one drug is not available in tablet form, means that cannot be given orally. What is that? Is it carbamazepine, are tramadol or amifostine or pilocarpine hydrochloride. Which drug is not available as tablet form? So the drug is amifostine. Next, severity of immunosuppression in an individual can be measured by. So we are treating some immunocompromised patients also because they are more prone to get infections. So we should know the level of immunosuppression in a patient means we have to know absolute lymphocyte count, absolute neutrophil count or neutrophil to lymphocyte ratio or any of the above will give the severity of the immunosuppression in a patient. What is the answer? The answer is absolute neutrophil count will help you to know the severity of immunosuppression in a patient. That is neutrophil count. Next, opiate analgesics are not preferred in which type of pain? Acute pain, chronic pain, prolonged intractable pain or visceral pain. In which type of pain the opiate analgesics are not preferred? Answer is of course acute pain. In acute pain always the standard drug is NSAIDs. Sialorrhea is treated by, what is sialorrhea? It is again an increased secretion of saliva in the mouth. It is treated by atropine, glycopyrrolate, diphenhydramine hydrochloride or all the above. Which drug is used to treat the to decrease the salivary flow? What is the answer? The answer will be all the above. Atropine, diphenhydramine hydrochloride, nothing but like say antihistaminic drugs or glycopyrrolate. So all these drugs can be given, can be used to treat the sialorrhea in a patient. The sealing effect is present with. So just go through this topic, sealing effect. This effect is present with opioid analgesics or NSAIDs or antidepressants or anticonvulsants. Which drugs will have this effect? That is, if given chronically, the pain reducing effect will be decreased. Okay. The answer is NSAIDs. These drugs will have sealing effect. So for that reason, in a chronic patients, mostly the drug is, these NSAIDs are given in combination with opioid analgesics or in combination with antidepressants, anticonvulsants or muscle relaxants. Next, orofacial pain may be treated with anticonvulsants, opioid analgesics, muscle relaxants or all the above. As we discussed, the answer is all the above. All these drugs will be given to these patients because of the pain is present like chronically, and also there are many reasons for the orofacial pain. Next is amifostine. What is this drug? It is, we discussed, it is available, it is not available as oral prescription. That is, in tablet form it is not available. We discussed where it is used. It is used to during procedures involving the bleeding, excessive bleeding, or to reduce the radiation induced salivary gland damage, or to treat chronic pains, or in all the above cases we can give this amifostine. Where it is used? It is mainly used to reduce the radiation effect on the salivary glands. That is, as a cytoprotective drug it is used. That is, it will protect the glandular tissue of the salivary gland from damage due to the radiation. Okay. So this is about the pharmacology in dentistry. That is the brief topic that is about drugs used in dentistry. So according to the questions, you can revise the topics and go through the topic in detail. Thank you. Thanks for watching. Please do subscribe to my channel for further discussions. Thank you.